Welcome to Men Talk Live. I'm Dr. Olivia Smith. Tonight, we are exposing a terrifying medical crisis hiding inside the medicine cabinets of millions of aging Americans. They take these pills every single night, believing they are protecting their hearts, lowering their cholesterol, or safely managing their pain. But clinically, these exact routine medications are acting like a biological wrecking ball inside your body. They are silently destroying your kidney function, starving your brain of vital nutrients, and accelerating memory decay. Millions of elderly patients are walking straight into irreversible metabolic traps, and their doctors are too busy to warn them. Today, we are pulling back the curtain on clinical pharmacology. I am going to reveal the top 3 most dangerous everyday medications that elderly patients must stop taking or adjust immediately, and the exact science-backed protocols to protect your organs naturally. If you want to save your longevity and rescue your brain, do not look away from this broadcast. To understand why these medications become toxic as we age, we must look at the mechanical decline of our filtration organs. In your 30s and 40s, your liver and kidneys possess a massive reserve capacity to filter, neutralize, and excrete pharmaceutical compounds. But by the time you reach 65, your renal blood flow has decreased by nearly 40%, and your liver mass has shrunk significantly. This creates a dangerous pharmacokinetic failure. Medications remain trapped in your bloodstream for twice as long, circulating at toxic concentrations. This is further aggravated by a medical phenomenon known as polypharmacy, where one drug causes a side effect, and instead of removing it, your doctor prescribes a second drug to treat that side effect. This creates a cascading breakdown of your cellular homeostasis, leaving your mitochondria completely suffocated and unable to produce energy. The medical establishment has a strictly documented safety list known as the Beers criteria, which explicitly warns against specific drugs for seniors. Yet, they remain among the most prescribed pills in America. Here are the 3 dangerous medication traps you must investigate immediately. Trap number 1, chronic NSAID use, the kidney killer. Everyday over-the-counter pain relievers like ibuprofen and naproxen are treated like candy. But mechanically, these drugs block an enzyme called COX, constriction locking the blood vessels traveling to your kidneys. This deprives your renal tissue of oxygen, quietly driving you into chronic kidney disease while spiking your blood pressure. Trap number 2, long-term statin therapy, the brain and muscle drain. While statins are aggressively prescribed to lower cholesterol, your brain is actually made of 20% cholesterol. Chronically starving your body of this vital lipid completely disrupts the protective myelin sheath of your nerves. Furthermore, statins deplete your cells of coenzyme Q10, triggering severe muscle wasting, chronic fatigue, and false dementia symptoms. Trap number 3, first-generation antihistamines, the acetylcholine wipeout. Millions of seniors take over-the-counter sleep aids or allergy pills containing diphenhydramine. These drugs carry powerful anticholinergic properties, meaning they completely block a critical neurotransmitter called acetylcholine. In the elderly brain, this induces immediate confusion, severe short-term memory loss, and drastically increases the long-term risk of Alzheimer's disease. Now, here is the clinical protocol to safely reclaim your health. Never stop a prescribed medication cold turkey. Instead, work with your healthcare provider to safely taper down while introducing these powerful, natural biochemical replacements. Nutrient number 1, molecularly distilled omega-3s. To naturally support cardiovascular health and clear arterial plaque without the brain-draining side effects of overprescribed statins, your body requires high doses of EPA and DHA. Omega-3 fatty acids actively reduce systemic vascular inflammation and naturally maintain healthy blood viscosity. Nutrient number 2, high absorption CoQ10, ubiquinol. If you must stay on a statin, you must supplement with ubiquinol daily. This directly restores the mitochondrial energy centers that the medication destroys, reversing drug-induced muscle pain and protecting your heart muscle from cellular fatigue. Nutrient number 3, high-dose curcumin and boswellia. To safely replace toxic NSAID painkillers, utilize this powerful botanical synergy. Clinical trials show that standardized curcumin extracts block inflammatory pathways with the same efficacy as ibuprofen, without restricting blood flow to your kidneys or burning your stomach lining. Nutrient number 4, magnesium glycinate, the natural sleep architecture. Instead of blocking your brain's neurotransmitters with toxic over-the-counter PM sleep aids, introduce magnesium glycinate before bed. It safely crosses the blood-brain barrier, relaxes your nervous system, and lowers cortisol naturally for deep, restorative sleep. True health does not come from a pharmacy bottle. It comes from understanding how your body ages and protecting your vital filtration organs from chemical overload. By questioning your prescriptions and feeding your cells what they actually need, you take total control of your longevity. Before we close tonight's medical briefing, I want to ask you, how many daily medications are currently in your cabinet? And have you noticed memory lapses or muscle weakness? Let's start an honest conversation in the comments below, and I will be answering your questions directly. If you found this broadcast valuable, click the like button, share it with an elderly loved one who needs to hear this warning, and subscribe to Men Talk Live for your weekly dose of science-backed longevity protocols. I'm Dr. Olivia Smith. Protect your organs, and I will see you in our next medical deep dive.